Welcome to the Drug Class Crash Course. We'll cover essential medications for clinical practice and exams, focusing on high-yield drugs crucial for family nurse practitioner, adult gerontology nurse practitioner, National Council licensure examination, and medical boards. Let's dive into rapid-fire, unforgettable learning with Dr. Famous Favor, clinical education consultant. Antihypertensives include ACE inhibitors, like lisinopril, which block angiotensin 1-2 but may cause dry cough and hyperkalemia. ARBs, like losartan, avoid cough but still risk hyperkalemia. Calcium channel blockers, such as amlodipine, can cause edema. Thiazide diuretics, like hydrochlorothiazide, increase calcium and are first line for hypertension. Beta-lactams, like amoxicillin, require checking for penicillin allergies. Macrolides, such as azithromycin, can cause QT prolongation and gastrointestinal upset. Fluoroquinolones, like ciprofloxacin, risk tendon rupture and should be avoided in children. Tetracyclines, such as doxycycline, cause photosensitivity and are contraindicated in pregnancy and children. Short-acting beta agonists, like albuterol, are rescue inhalers but may cause tremor and tachycardia. Selective serotonin reuptake inhibitors like sertraline are first line for depression and anxiety, but may cause sexual dysfunction and gastrointestinal upset. Serotonin norepinephrine reuptake inhibitors, such as venlafaxine, act on serotonin and norepinephrine, but can increase blood pressure. Tricyclic antidepressants, like amitriptyline, have strong anticholinergic effects and are lethal in overdose. Antipsychotics, such as risperidone, can cause extrapyramidal symptoms and significant weight gain. Warfarin requires close international normalized ratio monitoring due to vitamin K interactions and a narrow therapeutic window. Direct oral anticoagulants like apixaban are easier to manage without routine lab monitoring. Heparin needs partial thromboplastin time monitoring and vigilance for heparin-induced thrombocytopenia. Metformin is first line for type 2 diabetes mellitus, but may cause gastrointestinal upset and vitamin B12 deficiency. Insulin poses a hypoglycemia risk. Glucagon-like peptide 1. Agonists aid weight loss, but can cause nausea. Sodium glucose cotransporter 2 inhibitors offer cardioprotective benefits, but may lead to urinary tract infections and dehydration. Pain medications include non-steroidal anti-inflammatory drugs, which pose a gastrointestinal bleed risk and should be avoided in renal impairment. Opioids can cause respiratory depression and have a high addiction potential. Acetaminophen is safe in pregnancy but toxic at high doses. Cardiac medications like beta blockers reduce heart rate and blood pressure, nitrates relieve angina, and statins are first line for dyslipidemia. Keep studying, you're on the right track. This crash course covered essential medication knowledge for clinicians. Subscribe for more high-yield sessions, share with peers, and comment on future topics. Dr. Famous Favor, your clinical education consultant, signing off. See you in the next session.